Hi, Dr. Payne here with Rejuvenate Health and Wellness Centers. And this 5 minute field tip is to open your mind and enlighten you and educate you on the fact that antacids are not good. Okay. Now, one of the most prescribed medications, one of the most common uh, supplements that you take over the counter. But if you happen to use antacids often, and you tend to use them, say, for example, as soon as you are done eating, you notice you're having some burning, some pain in your chest, sometimes some burning as well in your chest. Maybe you're having a little bit of nausea after you eat. It feels like you have to regurgitate just a little bit. Some people have some belching that they experience too right after they eat, or if they lay down and they get some of those symptoms, then you can be experiencing what's called gastric reflux. And what many people do not know is with digestion, when you first see food, think about food, or you're getting ready to chew your food, your vagus nerve in your brain immediately, it's a nerve that leaves your brain and goes down into many parts of your body, but definitely your gut. It will cause your not only your salivary glands to start salivating, but also it'll cause your stomach to start eventually secreting what's called hydrochloric acid. And that's the acid in your stomach, the enzyme that helps to break down and helps to absorb certain things like proteins. So when you have a deficiency in hydrochloric acid, sometimes you experience those symptoms such as the burning and the reflux. So some people even have a dry cough that doesn't go away, which would be hard to describe now since we're having to deal with wintertime and colds and flus and COVID. But if you happen to have this dry cough, especially after you eat, then you may be having this reflux. So if you do have this reflux, it's a huge red flag for GI imbalance. Okay, your gastrointestinal tract is definitely off. The reason why is because hydrochloric acid has multiple functions. Yes, it is to break down food so you can start absorbing your nutrients like proteins, but it also helps to neutralize and get rid of certain foreign particles that you're not supposed to have or your body's trying to fight off, like viruses and bacteria. So if you have low hydrochloric acid, it's going to have you end up being more prone to having infections in your stomach, and infections, period, because you don't have the presence of the acid there to help break that down. So having to depend on antacids is just treating the symptoms, but it is not solving the problem. So some of the causes of reflux is wide range, but you can have what's called an hiatal hernia. And that's where a portion of the stomach actually sticks through the diaphragm and it causes an interruption in the digestion of food into the stomach. You can also have an issue with the doorway between your esophagus, which is the tube that runs from your mouth to your stomach. That doorway between the esophagus and your stomach, it doesn't close all the way. And so sometimes that acid will basically go backwards into your esophagus and cause ulcers and discomfort, like we mentioned earlier. Now, some eating disorders can lead you to have gastric reflux. And then some different types of metabolic syndromes, obesity, also can contribute to you having reflux as well. Also, age. So, as we age, we lose the ability to make as many enzymes or the amount of enzymes that we're supposed to have in our body. So those are some of the most common causes of having reflux. But also, if you have some, what we will talk about, and I will post this tomorrow because somebody asked me about this, but when you have issues in the brain, where it's not functioning along that brain gut connection, that can also lower the amount of hydrochloric acid. So We'll talk about that tomorrow. I will definitely be live to talk to you about how the brain plays a role in the gut. And some people don't know, but if you have hypothyroidism, that also will lower the production of hydrochloric acid in your stomach. So if this is an ongoing thing that you're having, this is a huge red flag that something's not right. Now, if you have it every now and then, but if this is something that's currently occurring, then you've got to do something about it. So the importance of stomach enzymes. Number one, we talked about absorbing your nutrients like protein. Then we talked about also killing viruses and bacteria that aren't supposed to be there. But hydrochloric acid is also important in absorbing calcium. So it also, if you're not producing a lot of hydrochloric acid, can result in you not absorbing iron well. Some people have a B12 deficiency. And so they end up with mineral malabsorption issues, and that can also cause more problems in your body, more inflammation. So you need the acidity of hydrochloric acid to absorb calcium. So you can take multivitamins all day long, but if you're low in hydrochloric acid, those minerals will not be absorbed. It will be harder for them to be absorbed. So you've got to get that fixed. So some people who are dependent on these antacids end up with osteoporosis. They're unable to absorb vitamin D well because of the low calcium in their body. You need calcium to absorb vitamin D. Also, if you are having low hydrochloric acid in your stomach, you're more prone to infections like H. pylori. I'll talk about that when I post my live tomorrow. An H. pylori infection, you'll be more prone to food sensitivity. So it's a domino reaction that just occurs in your body that increases systemic inflammation, increases pain. Okay, now, when you have a dysfunction in your hydrochloric acid production, it can result in ulcers forming, and or it can result in damage to the lining of the stomach and the lining of your esophagus. But there is something that you can do at home, and I will have a disclaimer on that, and I will mention why here in a second. But if you have apple cider vinegar, if you can get a hold to it, and if you at your next meal, if you take 2 tablespoons of apple cider vinegar, within 5 minutes of eating, either before or after you eat. And if you're prone to reflux after you eat, okay, and you do this for maybe 1 or 2 meals, and if you notice that your symptoms of reflux gets better, then you know that your issue is a hydrochloric acid production issue. If you do the 2 tablespoons of apple cider vinegar, remember it's 5 minutes before you eat or after, and you get worse, then that means that that acid or that acidity of that apple cider vinegar is making the lining of your stomach irritated. You may have ulcers. Who knows, you may have a H. pylori infection. That means that the lining of your stomach is irritated and it's damaged. So in that scenario where you feel worse after the apple cider vinegar, that means that you need to repair the lining of your stomach before you start supplementing with apple cider vinegar or hydrochloric acid tablets. So there's one supplement that you can take that can help with the lining of the stomach, and it's called DGL licorice. Now it's something you can get over the counter. I sell it as well, but you want to be careful with this because for a certain couple of reasons. Taking it can lower your potassium. So if you're on potassium lowering drugs like diuretics, corticosteroids, or other medications that lower your potassium, then you want to watch out for it. If you have high blood pressure issues, you want to watch out for licorice. So when it comes to supplementing that in your diet, you want to do it on the direction of a health practitioner like myself. to make sure that you're doing it safely. So that's something that you can help to repair the lining of your stomach. Now, after you do this for a while and you use the DGL licorice for a while, then you can start implementing some of the apple cider vinegar as well into your right before your meals or after your meals. And that will help start producing the HCl that you need, or the acidity to digest, especially your proteins. So once the lining is repaired, now you can safely introduce the proper amount of acidity to digest your foods. So that's an easy remedy that you can do, doesn't cost much. And you can kind of tell whether you have a lining problem or an HCl production problem. Now, I want to reiterate, before you do DGL licorice, you want to make sure that you do it under the supervision of a health practitioner. And you want to make sure that you really pay attention from now on when you eat. Are you belching a lot after you eat? Are there certain foods that you avoid? Like you avoid protein because you feel like after you eat a high protein meal, it just sits in your stomach. And that's because you're not digesting that protein. Maybe after you eat a huge carb meal, you're splurging and you want to eat pasta, and you realize that you just have discomfort, you have bloating, and you feel horrible. Sometimes that's a pancreatic enzyme deficiency. If you eat something that's fatty, or even if it's good fats, and you notice that you have discomfort, a lot of gas, bloating and belching, and just your stomach hurts, it could be a gallbladder function issue. So I hope you guys enjoyed this. If you are a habitual antacid user, now you know what causes it, you know the effects, you know that it could be the lining of your stomach that's irritated. I want to make a point too, that if the lining of your stomach is irritated, you want to make sure you get with a health practitioner to make sure that you don't have a H. pylori infection. Because if it goes unnoticed, it can result in terrible issues like autoimmune issues and even cancer. So I hope you guys enjoy that. That's your 5 minute or maybe 10 minute mind fuel tip for today on antacids and acid reflux. Thank you.